Okay, I've got a little analogy for you. All right, let's say we take this rubber band and let's say we put it on our finger. Okay, we're going to keep putting it on round and round and round until finally we get it on there. Okay, now let's say we can't see this rubber band. But at first, we start to notice that maybe we're starting to get some symptoms, right? Maybe some numbness, maybe a little tingling sensation, maybe even a little pain, right? So, what's the first thing typically, if you went to your medical doctor, what are they going to do? Well, they probably say, oh, well, it hurts, so let's do this. Let's give you medication, right? You take a Tylenol, an ibuprofen. If that medication doesn't really numb it, then eventually, maybe we do like a shot, like a cortisone shot or something to really, well, okay, maybe the pain goes away. Okay, but now we're starting to see it's starting to kind of change color a little bit. So there's a blood flow issue here, right? So what's going on? So let's say maybe we go in and we do a bypass surgery. We cut the vein and artery on one side, we cut the vein and artery on the other, we reconnect the blood vessels, and now we get good blood flow. Okay, but we leave it. Eventually, what's going to happen? What's going to happen to that finger? Well, if you leave that rubber band on there long enough, I promise you what's going to happen is that end of your finger is actually going to die. Okay, and if you don't believe me, you put a rubber band around a body part, leave it there long enough, it'll die, fall off. I can take you back where I grew up in Kentucky, where we turned bulls into steers, and you'll quickly find that a rubber band around a body part will remove it, right? So eventually, the end of your fingertip starts to die. Why is that? Well, we got blood flow, right? We opened up the blood channel, so the blood's flowing. Why would the finger start to die? Well, because we have cut off the nerve supply to the end of that finger. Well, what happens in upper cervical is we have found that there is a place right up here at the top of the neck where it puts pressure on the brainstem or the nerve system. And that's like having a rubber band around your neck, which is interfering with the messages from your brain to your body. It can be affecting your digestion, your immune function, how you sleep, your blood pressure. Any function in your body travels from the brain through the brainstem down to the body and goes out to all the different body parts. So if there's a rubber band around the brainstem interfering with the messages, the only solution is to actually remove the rubber band from the brainstem to allow the messages to reorganize and transfer from the brain to the body so that things start to go back to normal. That's what we do as upper cervical doctors. We find the interference to the nerve system, we remove the interference, and then things start to work the way they're designed. That's just the way the body works. That's what we do as upper cervical doctors. I hope this makes sense. I hope the little rubber band analogy kind of makes sense for you. Find an upper cervical doctor near you. UCCnearme.com is a great resource. Anything I can do for you, just let me know.